Hello, everyone. We're at episode 17, and guess what today is about? Google is not your professor. Finding the balance between online learning and nursing school. Yes, it's me, OB Clarity with Dr. Godfrey. I'm Dr. Godfrey, PhD RN, and welcome back to OB Clarity. Welcome back, and today we're talking about something I'm seeing more and more with nursing students, something that's affecting how they study, how they understand content, and even how they perform on exams. Here's the problem. More students are learning from TikTok, YouTube, Google, and other platforms, sometimes more than they learn from their professor. Is that a surprise? It's not because they don't care, not because they're lazy, but because these platforms feel faster, easier, and more digestible. And while that sounds convenient, it comes with challenges, especially in a profession where critical thinking and clinical judgment determine patient safety. So, what's the reality of today's learner? Let's talk about it. I want to be honest. The way students learn today is different. I will say that again. The way students learn today is different. It is not the same as when I was in nursing school a long time ago. You grew up with instant access to information. You're used to short videos, visual explanations, mnemonics, summaries, and those quick aha moments, right? And I want to be really clear. There is nothing wrong with that. In fact, OB Clarity with Dr. Godfrey is on TikTok. Yes, I'm on YouTube also. And my presence on those platforms is going to expand in the near future. So I am not against those methods. Why? Because I believe in meeting students where they are. I know that for many of you, a 30-second clip explaining a concept can finally make something click in a way a textbook didn't. So let's set the tone. We're not here to bash the platforms. No, TikTok, YouTube, Google, they can be incredibly useful. I use them. The whole world uses them, it appears. But the problem isn't the platforms. The problem is when students begin trusting them more than their curriculum or using them instead of their curriculum. There should be some balance. You should always make sure that you're checking with those objectives that your instructors have, that you are following the outline that the clinical pieces have, that the theory has. Just make sure that you're checking, right? So, why does this matter? Nursing is not just memorizing facts. We know that. It's not like just because you learned something yesterday and it was quick, it was fast, that you can memorize that for a test, right? So, it's knowing why something is happening. It's applying knowledge in a clinical setting. It's recognizing what's urgent, what's subtle, what's dangerous, and what needs action right now. Online platforms aren't built to teach judgment, they're built to grab attention, which is why we go to them so fast, right? So, yes, TikTok can give you a tip about preeclampsia. I have one on there, right? It went viral, believe it or not. So, YouTube can show you a mnemonic for fetal heart tracing variability. Google can summarize magnesium sulfate in 3 bullet points. But what they can't do is teach you safe practice, right? They can't walk you through a scenario. They can't connect multiple symptoms. They can't prepare you for the NCLEX blueprint. They can't walk you into a patient's room and guide your thought process, right? And that's where the imbalance happens. But oh my goodness, are there many great things about these platforms? Absolutely. But let's talk about the value of your nursing program. Because remember, you do need the nursing program to get your degree. Your professors, your program, your clinical experiences, those are what give you the foundation, the standards, the evidence, the structure, the depth, and the judgment that your license will depend on. TikTok can support your learning, but it can't award your degree. YouTube can explain a concept, but it can't teach full clinical reasoning, right? Google can summarize, but it can't prepare you for patient care. So, none of these platforms can replace the accountability that comes with being in an accredited program. You need both. You need your foundation and your supplements. So, let's talk about solutions now, how to find that balance. Let's talk about how to use all these resources in a healthy, productive way. Solution one: use online content for clarity, but not curriculum, right? If TikTok helps a hard concept click, great. But let your program give you the foundation and let online creators reinforce it. Solution two: Always verify what you see online. It takes 10 seconds to check something in your notes or textbook. If two creators contradict each other, ask your professor. Conflicting information is a sign to get clarification, not to guess. Solution 3. Bring your online questions to class or office hours. If TikTok says you always give this medication for this condition and your book says something different, that's a perfect moment to ask. That's literally what your professors are there for. Solution 4. Create your own blended study approach. Here's what this looks like. Start with your lecture or your assigned reading, then watch a short video to reinforce. Then practice NCLEX style questions, and then teach it back or summarize it, right? This gives you the best of both worlds. It provides depth and it provides clarity. Solution 5. Ask yourself, am I learning or escaping? Sometimes students go to TikTok because it feels easier. Sometimes they're overwhelmed and they want a shortcut. Sometimes they're procrastinating. And I say this with love. Those moments are exactly when you need structure, not speed. Solution 6. Know when to pull back. If you find yourself confused, overwhelmed, or unsure who to believe, step away from the algorithm and return to your foundation, your class, your notes, your textbook, your educators. We're there for a reason. Now let's talk about empowerment as I close. You're living in a time where you have more learning tools than any nursing student generation before you, certainly more than what I had, and I think that's amazing. It's incredible. Use them, enjoy them, learn from them. Just use them wisely. Find your balance. Let online creators support you, but not replace your education. Let quick videos give you clarity, but not too many shortcuts. And always remember your nursing program is what prepares you for safe, real-world practice. Online learning is the supplement, but it's not the substitute, right? So I hope that this short little podcast helped you today as we talk about those wonderful platforms that are out there and many things that you guys are using right now to learn, and I think it's amazing. I just want you to always remember your foundation and where you can go to make sure you get your degree, right? So, as I always say when I close, always assess, don't guess.